now we can begin.
Good afternoon, everybody, and welcome to our July 2nd media availability following the Emergency Advisory Committee meeting of Council. We have a short amount of time for this availability, so once you've heard from the Mayor and then from Adam Laughlin, we're going to take just one question from each reporter, and if we could keep them brief, that would allow Mayor and Adam to get back to the councilman that follows this availability. So I appreciate your cooperation. Thank you also to Kevin Culp and Diane DeAndrade for their terrific interpretive services. If I could ask the media to mute your mics while we hear the opening remarks, that would be great. Go ahead, please, Mr. Mayor.
Well, thanks, Katrin, and I'm going to try to be uncharacteristically brief, at least in my answers to the questions as well, given the important matters that we have to get back to at Council yet this afternoon. But I do want to address the NHL Hub City matter right off the top, because there's much excitement and still a fair bit of speculation around it. I have to be clear that the NHL and OEG have not yet formally confirmed that our city has been selected as a hub city, but I do understand that Edmonton continues to be a serious contender, and I believe this would be rad. But if we are chosen, I need to say that I truly believe that it is Edmontonians who earned this possible win. We know that the fact that Edmonton has low COVID-19 cases was one of the key reasons why our city remains a top contender. And our low cases can be directly attributed to Edmontonians themselves, who have been working hard to prevent the spread of COVID-19 and who have been themselves, by and large, following the excellent public health guidance Alberta Health Services has given. So keep up the good work, Edmonton. We've earned this, if it pans out. On that note, though, I'll move on to the city's ongoing response to the pandemic itself. Council heard directly today from Dr. Chris Sikora, who is the medical officer of health for the Edmonton region. And some of the topics discussed included the options of mandating masks in public spaces, especially since Toronto has now made it mandatory to wear masks indoors. I need to clarify that we are a little bit different than Toronto in that their health authority falls within the City of Toronto as municipal jurisdiction. For us, the direction would come primarily from Alberta Health, and they have not yet mandated masks for their reasons. Now, all of us on council have certainly received a lot of correspondence on masks, and we continue to very strongly recommend and encourage Edmontonians to wear masks in public spaces where physical distancing is not possible, including on public transit. There are concerns, however, about making masks mandatory, especially as it relates to City of Edmonton facilities and public transit. Enforcement of masks, real and effective enforcement of a mask order, would be a challenge for the City of Edmonton. First of all, we'd have to either create bylaws, which there just isn't an appetite right now to do, because enforcement of this law would be difficult, and it might even be discriminatory to those who cannot wear masks for whatever reason. So it's not as simple as an order and not straightforward to enforce. So for now, we will continue to encourage Edmontonians to wear masks, but we're not in a position to mandate it. We will, however, also continue to promote other public health measures that folks should be taking to prevent the spread of COVID-19, including continuing to practice good hand hygiene, washing your hands, specifically for 20 seconds, as we've all hopefully become accustomed to doing. Continue to practice physical distancing, monitoring for symptoms, and self-isolating if you're not feeling well. It is our continued vigilance that has saved lives and will continue to save lives and ensure that our economic restart is successful. And with that, I'll turn things over to Adam to provide some more specifics on what we heard today and what the city's working on, and happy to answer some quick questions. Thanks. Adam?
Thank you, Mr. Mayor. Good afternoon. Thanks for joining us today. Today at the Emergency Advisory Committee, I provided updates on the city's recent relaunch activities. We are relaunching the opportunity for yard and garage sales this summer. Following the Stage 2 announcement by the Government of Alberta, we began working closely with Alberta Health and Alberta Health Services on guidelines, and we've created guidelines to support safe operations of those garage sales. There's a limited number of picnic site bookings and spaces for small-scale events of 200 or fewer that will be allowed in the River Valley. Effective this weekend, city picnic sites outside of the River Valley will be available for spontaneous but non-booked events. In March, the Ambleside Eco Station was turned over to Alberta Health Services for COVID testing, leaving the 3 eco stations open to the public. After completing more than 34,000 tests, AHS advised last month that the testing facility would be closed, and as such, we are scheduled to reopen that on July 8th for waste services operations. Other items, city will be allowing licensing for outdoor events of up to 200 people on public land, and it will begin to review requests for events on private land. This decision means Edmontonians can host events such as religious services, fitness programs, interactive art installations, food truck events, runs and walks on city and private property with restrictions. Again, we still need, as the mayor said, still need to follow the provincial health restrictions. The city is not currently issuing event licenses for gatherings larger than 200 people on public land. Permits can be issued for fireworks on private property that are managed by property owners. Spray parks, we've identified 25 would be opening this summer. 22 are open, with the 3 remaining by mid-July. We've reactivated golf group lessons for adults and children, and that's at the Victoria Golf Course beginning July 13th. The Prince of Wales Armory has reopened to the public starting today. This includes the City of Edmonton Archives and the center tenants, the South Alberta Light Horse Regiment Foundation, the Edmonton Arts Council, and the Edmonton Heritage Council. The Edmonton Eskimo Football Club has been given access to the Commonwealth Stadium to begin phase 1 of their training for the 2020 CFL season. And the City of Edmonton will reopen 12 sites leased from Capital Region Housing for non-profit agencies and other organizations to activate their summer programming and addiction support services. As the mayor mentioned, masks were discussed today, and again, not recommended as mandatory, guided by Alberta Health and Alberta Health Services, but continuing to monitor, and Dr. Sikora shared some good information to support that recommendation. We meet with, our team meets with Alberta Health Services twice a week to ensure that we're aligned on decisions as it relates to public health orders and city operations. The other thing that we'd encourage, on behalf of the province, ensure that folks download the AB Tracing Together app on their mobile devices. It certainly helps with any of the tracing activities that are required should there be a spread. That concludes my comments. Happy to take any questions.
Thank you. So there was a couple of updates. We're going to do a lightning round of questions, starting please with Scott from 630 Chad. Go ahead, Scott. Okay, we'll move on to Dustin Cook. Oh, are you there, Scott? Hello, Scott, are you there?
Yes, I'm there.
Go ahead.
The delay on the YouTube channel is a real challenge. Adam, you guys were so dead set against garage sales for the longest time. What flipped the switch? What turned it for you?
Is the question on garage sales? Sorry, Scott, I just didn't hear that.
Yeah, on the garage sales. What turned it for you?
Well, I think part of it was, again, leading off of the provincial government in terms of reopening and relaunching, and public feedback, and the desire to create opportunities. And Mr. Aiken shared today that this does create opportunities for some of those folks that are struggling financially to utilize this to help them. Certainly something we will be monitoring, and we'll continue to monitor. But I think this is another signal of general reopening that has been guided by the province.
Thank you, and sorry, Scott, for rushing you there. Dustin Cook from the Journal, please go ahead.
Hi there, thank you for taking my question. Probably for Adam. we've heard, that the Transit Advisory Board is recommending masks, and I know we heard from the health perspective today, but then there's also the comfort level of wearing masks. So if people are not using transit, being deterred from using transit because masks are not mandatory, would that force the city to reevaluate this decision?
Thanks, Dustin. Good question, and actually good question from Councillor Knack and suggestion from Councillor Knack today. And post-meeting, I checked with Gord Sebrick, and he identified that we're actually doing some surveys with the Insight community right now. And if we get some feedback that creates sort of an openness to returning to transit on the basis of mask being mandatory, that's something we'll evaluate. We'll continue to do it, though, in alignment with the provincial health authority to ensure that we're not taking a step that impacts any decisions that they would be making. So I think it was a good suggestion, and I appreciate the feedback from ETSAB, and we'll continue to engage on this and see if that's something that does facilitate a change for us from a perspective of mandatory masks.
Thank you, Dustin. We'll go next to Jeremy Thompson in the room, followed by Natasha Reid. Go ahead, Jeremy.
I think my question is also for you, actually, Adam. You mentioned in your presentation that the shelters that have been set up, Expo Center, Kinsman, those might be sort of winding down as far as existing how they do now. Can you talk more about that? What is sort of leading to that decision, and I guess what are you monitoring as that change happens and those folks start to maybe mingle more than they have been before?
So it's been a joint body of work to see about the wind down of those facilities. It's been the provincial government, Alberta Health Services, the City of Edmonton, the agencies working together around the wind down. Some of the drivers behind it is actually, the mayor mentioned this in general about the performance, and within that community we've had one case, and that one case was actually sort of a non-resident, if I could call it that, of Edmonton. It was someone that was traveling through. And so set up for good reasons to support that population, but from an incident perspective, we haven't thankfully realized any of those incidents. So it's consistent with other reopenings that are happening, in that we need to start to get back to a bit of the new normal around back to supporting them within a different system as the needs for those facilities start to ramp up.
Thank you, Jeremy. We'll go next to Natasha. Go ahead. Natasha, are you with us? I will move on to Vinesh. Go ahead, Vinesh.
Oh.
Go ahead. Vinesh, if you could be patient. Go ahead, Natasha. Sorry for the delay.
Okay, somebody muted me, I think. Anyway, okay, sorry about that. My question is for Mayor Iveson. Mayor, I'm just at this point with the increase in cases in the past few weeks in Edmonton after the relaunch, and then the decision today not to make masks mandatory, people gathering in large numbers and the spread. How confident or comfortable are you right now that these numbers will kind of stay at bay?
Well, a couple of things give me confidence. Thank you for the question. First of all, the track record of Edmontonians to date, and in particular where there have been small outbreaks, the leadership of business owners, managers, and entrepreneurs to protect their staff and close back down where the testing shows and the tracing shows that there's an outbreak associated with a business. I think that's incredible corporate social responsibility. And illustrates the fragility of relaunch and the need for everyone to maintain really good hygiene around this. But it also speaks to the robustness of Alberta's testing and tracing capacity. So with, and I asked Dr. Sikora about this just a little while ago, about on the order of up to 3,000 tests happening in Edmonton here, primarily asymptomatic tests, and a positive rate in the below 1% range. So those are key metrics for epidemiologists that we've been tracking closely here. that compared to other jurisdictions where the testing rates are 10% or 50% of people getting tested showing up positive, that indicates that there's a whole bunch of people not getting tests that are likely positive as well. So the very low positives rate, the very high incidence of testing, the continued very strong compliance with public hygiene measures by entrepreneurs and patrons in our businesses and public spaces, all these things have added up to a linear progression of the virus. At this point, 10 to 30 cases a day is certainly different than what we were used to when we had absolutely planked this during the lockdown. But considering that we're well into the second phase of an accelerated relaunch here and still seeing a linear number of cases rather than exponential number of cases, we're in good shape. If that changes, obviously stronger measures will have to come into place very, very quickly to slam down transmission again. But as long as everybody is observing all of the guidelines, then we can keep this at bay and stay well within the capacity of the healthcare system to manage the cases that are presented by the very minimal community transmission that is occurring and being properly tracked and traced.
Thank you, Natasha. We'll go next to Vinesh, then Dan Grummett, and we'll close with Janet French. Go ahead, Vinesh. Are you with us, Vinesh? Dan from CTV, let's take your question.
Yeah, thanks for taking it. This would be for Adam. Just on the Hub City, the NHL Hub bubble, and the potential for Edmonton to be selected. And the report that Terwilliger Rec Center would somehow be involved. Has the NHL or have the Oilers approached you about using that? Have you granted them access if this return to play, this bubble thing comes to pass? Will the NHL be paying for that? And would the public still have access if indeed teams are using the rinks there?
Thanks, Dan. We've been in regular discussion with the Oilers Entertainment Group about this. Back when the original submissions were required to the NHL, we were engaged in discussions with them about different facilities that could be used to support their efforts. And we even had a conversation at council at one point, the Emergency Advisory Committee at one point, and confirmed an understanding from council around our participation in this. Still pretty fluid, Dan, still working through the details on that. What we do know is that Terwilliger is a preferred location because of what it can offer in terms of 4 continuous pads, but we haven't ironed out the details, and that's something that our folks, myself and others in the organization, are continuing to do with the Oilers Entertainment Group.
Thank you. I understand Vinesh is on the line. Vinesh, could you put your question to us now? While we're waiting for Vinesh, we'll go to Janet French. If you could make your question brief and the answer brief too. Go ahead, Janet.
She's not on the call anymore.
Thank you very much. Is Vinesh with us? We seem to be having difficulty reaching Vinesh. Vinesh, contact us via email or chat, and we will do our utmost to get back to you. In the meantime, thanks for being with us, and we'll speak with you very soon. And thanks for your patience as we hurried you along.
Thanks, folks.